So we're going to be talking about preparing for college SES, resources to empower students with mental and chronic health conditions today. We'll just go through the agenda really quickly. And I know that I got everybody kind of fingers moving in the chat box. And I wanted to say that we will take questions at the end, but if you have questions or comments that come up during the presentation and you want to put them in the chat, you can do that as well. So we're going to do our introductions. We'll go over a little bit of background. We'll talk about IDEA and the ADA. We'll look at considerations in the college search, and we'll look at leave of absence and withdrawal policies. And we'll take some questions at the end as well. But again, if you have questions during the presentation, go ahead and throw them in the chat and we will get to them when we can. So as Sam mentioned, I'm Annie Tulkin. I'm the founder and director of Accessible College. Accessible College provides college preparation and transition support services for students with physical disabilities and health conditions. So that might be a student who uses a wheelchair or a mobility device, or it could be a student with another type of chronic health condition like cancer, lupus, diabetes. I also work with students with mental health conditions. And as Sam mentioned, I am an academic advisor at the dorm as well. The reason that I provide this support is because colleges and universities provide varying levels of support services and accommodations for students with disabilities. And so the work that I do really helps to bridge those gaps for students and families so that they're prepared to be successful in college. I have over 10 years of experience in the disability field. Nearly 6 of those were at Georgetown University, where I was the associate director of the Academic Resource Center, which is Georgetown University's Disability Support Office. And there I supported undergraduate, graduate, and medical school students with physical disabilities and health conditions with their accommodations, and provided academic support services to the entire student body. The real catalyst for me to launch Accessible College was the time I spent at Georgetown. So at Georgetown, when I was working with these students, one of the things that I saw was that many students were unprepared for the transition to college. They didn't really understand what types of accommodations they could request. They didn't know the type of self-advocacy skills that would be required in the college setting. And so that's the sort of focus that I have now with the students and families that I work with. And so I'm going to hand it over to Adrienne to introduce herself. Go ahead, Adrienne.
Thank you, Annie. And thank you to all of you for making the time to be here today. As Annie said, I'm Adrienne Frumberg. I'm also an academic advisor at the dorm and the founder of Lighthouse Guidance. 4 years ago, I started Lighthouse Guidance, particularly to help students who have disabilities, health conditions, various social emotional challenges, mental health or drug addiction issues, find success after high school. I also work with students who are applying to transfer colleges or accrue credits through the non-matriculated student path. I'm a permanently certified school counselor in New York State, and I have 14 years of experience as a college counselor. Prior to being an independent consultant, I have worked at various independent schools in the New York City area, including Loyola High School, the Aaron School, which is a school for students with learning disabilities and special needs, and Fordham Preparatory School on the Fordham University campus at Rose Hill. I'm fully an independent college counselor now, and I work as a consultant both at the dorm and at Academics West, which is a therapeutic high school. The reason I started Lighthouse Guidance is because I feel so passionately about working with students and helping them find success, whichever path they choose. Though I work with applicants traditionally who are applying to college, I like to think of myself as an expert in working with students who have an atypical path to completing high school, or really just for students and families who need more support at the college level. My primary focus is working with those students who need that extra support to find the right college that is a fit for them. And I'm going to turn it over back to Annie to talk about some background facts.
Super. So let's look at the background to give us some grounding in this conversation. So here are some facts. So we know that approximately 19% of undergraduate college students report having a disability. And that's important data because it helps us kind of understand the numbers of students that are in college who go through the process to request accommodations in the college setting. So that's where that 19% comes from. And that includes students with learning disabilities or learning disorders, students with ADD, students with mobility impairments, students with psychiatric conditions and with health conditions. And I should note that the language is a little bit different in here than maybe what folks in the clinical setting are accustomed to. So in the college setting in higher ed, we typically say learning disabilities. You might hear psychiatric or mental health conditions. So if there's a variation in language, just understand that there might be some differences between the clinical setting. But the really important thing to remember about this is that 19% is the students who have gone to the disability support office and requested accommodations. So it's highly likely that there's another group of students who have conditions that may be eligible for accommodations, but either don't know they can request them and have not gone to do that, or have decided not to go and request accommodations. So that's just critical information to have, because we know that students with disabilities at 19% are likely the largest minority group on a college campus, just like people with disabilities are the largest minority group in the United States. So another fact that we have here comes from some research that the Association of Higher Education and Disability gives us, that says that disability support offices are seeing the largest increase in accommodation requests for students with mental health conditions. So the data that we have, it can be a little bit scattered, but that's because colleges collect their own data. So and sometimes the data is a little bit unclear in how the terminology is used, but that gives us a little bit of a grounding in what we're talking about. And I'm going to hand it back to Adrienne to talk about these facts.
Thanks, Annie. So to piggyback on Annie's list of facts, a startling 30% of college students are struggling with completing their schoolwork due to some type of mental illness. In particular, 27% are living with depression, 24% with bipolar disorder, 12% with other conditions such as dysthymia, eating disorders, OCD, or autism spectrum disorders, 11% with anxiety, though I probably believe the stat is higher today, considering where the world is at, and 5% with ADHD and 1% with substance abuse issues.
So we're going to use that as kind of a jumping off point to talk about IDEA versus ADA. And IDEA is the Americans with Disability, or excuse me, it's the Individuals with Disabilities Education Act, and the ADA is the Americans with Disabilities Act. So first on this screen, we've depicted it here for you. So we have the Individuals with Disabilities Education Act, or IDEA. That's the law that governs the K through 12 setting and covers special education supports and services in public schools. And so if your student that you're working with has an IEP or had an IEP, an individualized education program, it's because of that law. If your student is in a private school, a private high school, those schools are not bound by IDEA. However, they are bound by Section 504 of the Rehabilitation Act, which protects against discrimination on the basis of a disability. So students might have a 504 plan, which outlines their accommodations. And it's important to note that private and public schools have to adhere to Section 504, and it also applies to the college setting as well. So when a student graduates high school and moves on to college, the accommodations process is governed by the Americans with Disabilities Act. And the Americans with Disabilities Act provides for reasonable accommodations in the college setting. So there's a big difference from high school into the college setting, and that is that students have to be the ones who are requesting accommodations and engaging in what is known as the interactive process. So that means the student has to go into the disability support office, provide documentation, have a conversation with the disability support office folks, and then get approved for accommodations in the college setting. So they need to be able to self-advocate. The other thing that I wanted to mention here too is FERPA, the Federal Educational Rights and Privacy Act, and that's a law that typically surprises a lot of parents. Once the student matriculates to college, once they sign that dotted line, FERPA prevents the college from sharing information such as grades, class schedules, disciplinary action with the families. So students and families sometimes choose to sign what is known as a FERPA waiver, which would allow parents to have access to that information. That's typically done through the registrar's office at the college or university. And that requires an intentional conversation and agreement between the student and the family so that they can access that information. Let's see. So I wanted to talk a little bit, oops, I think that skipped ahead to a different piece. Hang on, sorry. Our slides got a little moved around. Okay, there we go. So I wanted to give a brief overview about the differences between accommodations in the high school setting and the college setting, because I found that a lot of students and families are unaware of how these laws change. So in high school, students with disabilities are typically identified by the school, and the teachers and administrators know about the accommodations as they're defined in that IEP, the academic plan, or the 504 plan. But in college, it's the student's responsibility to disclose to the Disability Support Office, provide documentation. So students really have to be comfortable talking about their needs, talking about their condition. In high school, the school usually takes the lead to arrange for accommodation. So if your student gets extra time on tests, for example, in high school, the school usually knows and they make those arrangements for the student. But in college, it's the student's responsibility to go ahead and make those arrangements. So building off that extra time example, if a student needs extra time on an exam in college, they typically have to follow a process through the Disability Support Office to request a time and a space to take that exam. And so that can take some really intentional planning and some executive function skills and organizational skills on the part of the student to make sure that they can get that in place. And then in high school, teachers usually identify when the students need support. They can connect with the parents and the families and have conversations. But in college, the student has to be proactive in seeking out support services by going to office hours, maybe hiring their own tutors, taking advantages of some of the services that their college might offer. And that's a big shift for students because they have to be able to identify when something isn't working and be able to take that step to reach out and get the support that they need. And we also know that transition services really vary from high school to high school. So if your student had an IEP in high school, they typically have transition services as a part of their IEP planning process. But if they had a 504 plan, or if they had a condition that was maybe more managed in high school and didn't receive any accommodations, typically no one is talking to those students about transitioning to college and the needs that they might have. So here we go. There, now we're on the right slide. So first I want to say that we should talk about the documentation that's required in the college setting, because I did mention that students would have to provide documentation in order to go through the formal process to request accommodations. So first, the student should always check with the college to determine what documentation they need to submit. Colleges can create their own documentation guidelines. They're typically quite similar, but there might be some variations. So depending on the disability or disabilities, there may be many types of documentation that are required. So for learning disabilities, ADHD, typically schools want to see a neuropsych evaluation that's been completed in the last 3 to 5 years. And again, that varies school to school. If your student has a mental health condition, they might have a psychological evaluation or a letter from their psychologist that outlines their needs and their accommodations and the type of treatment that they're receiving. If your student has a chronic illness or a physical disability or a visual impairment or a hearing impairment, typically a college would want to see a letter from the healthcare provider that outlines the types of functional limitations that the student has and outlines the types of accommodations that they may need in the college setting. Most schools, most colleges provide a template that you can download from their website to provide some support for healthcare providers who are completing these types of accommodation letters. But it's really important for students to contact the Disability Support Office, which might have a different name. It could be called Student Accessibility Services. It could be called Disability Support Services. Usually if you go to the school's website and you type in disability services, it'll come up. But they want to make sure that they're getting a sense of what those requirements are and doing that during their search process before they've even applied, ideally, or once they've been accepted, to do that kind of due diligence and to do that research to make sure that that Disability Support Office in that school is going to be a good fit for them. We'll talk a little bit here about supplementary documentation because this comes up a lot. These are types of documentation that provide history and information, but alone, they are not always accepted as primary types of documentation. So some examples include an IEP, an individualized education plan or program. That's not always accepted as a primary form of documentation. Typically, colleges want to see the full evaluation that went in to inform that IEP. A 504 plan. These are great for colleges to have access to and for students to provide along with their primary documentation, because both of those things, the IEP and the 504 plan, provide some history and information on the types of accommodations that a student receives. So that could be really useful information to the folks in the Disability Support Office who are hopefully helping that student determine what types of accommodations might be available to them. Some students come with a letter from their high school that just outlines the accommodations they may have had in high school. It's always good to have a copy too. If the student took the ACT or the SAT and they received any accommodations, you can submit that as supplementary documentation to the Disability Support Office so that they can see the types of accommodations that the student received on those types of standardized tests. And now, let's see. I'm going to hand it over to Adrienne to talk about some other considerations in the college process.
Thanks, Annie. So in terms of factors to think about for students with health conditions and physical disabilities, it's really important to think about how far from home the student and the family feels as an appropriate distance. Annie and I worked together with a client last year who was considering going all the way out to California and also looking at schools here in New York City. And, though he really enjoyed seeing the schools out in California, he felt like for an undergraduate, it might be wiser to stay close to home. So it's really important to encourage your student or your child to take those visits, to bring your child or your student on those visits. If they're really interested in going far away, you really need to make sure that they understand what that really means. So and also to consider how far they can be from their doctors and their support network. Is the student ready to go away to college, or should they spend possibly a semester at home transitioning academically first before moving into the dorms and living on their own? Sometimes, having a roommate for the first time can be rather challenging. So really thinking that through, having those conversations can be really important. And it might be easier to take that first step before jumping in fully. Also, do the students feel more comfortable in an urban environment, or do they thrive with the energy of the city or prefer a quieter feel of a suburban or more rural town? So those are some of the things that I discuss when they're considering what colleges really to put on the list. If they don't wish to keep their providers from home, ensure that there are providers local to the school that specialize in their particular health condition or their mental health issues. At some colleges, counseling or group counseling is available as a part of the student's tuition, and that's something that can be most of the time found on the website. If it's not on the website, then that's something that you can call and find out through the counseling center by phone. Also, and Annie's probably going to bring this up later, but sometimes talking to the counselors there in the counseling center, they can provide referrals for local providers who have experience with particular mental health issues. So it's really key to research and set up their care team the summer before going to college, or if they're starting in the spring, the December before they start in January. And this is something really to check in with, again, with that counseling center prior to the start of the semester. So that is really taken care of, and they can kind of check that box off as one less thing to worry about. And then finally, checking in with Res Life if sober dorms are something that the student is looking for, and coordinating that as well, possibly if they need a single room. Those are things that Residence Life can coordinate. So in terms of the support options at the college level, there are a few levels of support available to students on college campuses. As Annie mentioned, the ADA in Section 504 mandates equal access to post-secondary institutions for students with disabilities. The first and most basic level of support is that disability, or sometimes called accessibility office. And students can register with this office in order to receive their accommodations in their classes and their dorm rooms for physical disabilities. The second level of support is an academic support program on campus, which many of the students that I work with are looking for. And in fact, they do charge an additional fee for these services. The programs really vary based on the colleges, and some can offer up to 5 times a week of in-person academic services and academic tutoring in and various subjects with their own academic coach. So for example, Pace University has a program called Oasis, and they offer both academic and social support for students on the autism spectrum or students with other learning issues. Mitchell College has tiered levels of support, and they start with a more restrictive model for the first year, and students can then transition to fewer meetings as they become more comfortable with college level work. So it's really important to check in if the academic support colleges offer are tutors who are peers, or if they're actually a trained learning specialist. So with some of the students that I work with, they really are looking for that trained learning specialist who can help them with transitioning from, what's going on in high school and how to face college level work, which the expectations are a lot higher. A few other notable programs that I have students applying to and attending each year are the Learning Support Program at Marist College, the Iona College CAP program, Aspire at St. Joseph's University in Philadelphia, and the On Track program, which is fairly new at Syracuse University. So every year I'm seeing more programs popping up at universities. UConn has a great program. So, when students and families come to me, I try to assess how much help are they really getting at the high school level to see, going into college, the work level will be much harder. So we want to start with more help at the beginning, and then hopefully as students get used to it, they can kind of take away some of that support and be more independent. And the third type of support is the college exclusively for student with learning disabilities and special needs. Two that come to mind are Beacon College in Leesburg, Florida, and Landmark College in Putney, Vermont. I've toured both of these campuses and was very impressed with the high level of support and guidance and preparation for life for after college, particularly with the internship and career component. So I would say for those, I would say those are the two best in terms of the learning disabilities for those particular students. So I'll now turn it back over to Annie to discuss typical accommodations offered at the college level.
Great, thank you. I wanted to give everyone just a sense of what types of accommodations are typically available at the college setting. And it's important to note too that accommodations in college are not only for academics, there might also be housing, transportation accommodations, dining accommodations. So it's really critical that we're taking a holistic look at the student and what their needs are and supporting them and working through all of those needs to make sure that they're supported on that college campus. So in terms of kind of typical academic accommodations for learning disabilities, for ADD, for mental health conditions, we have things like extra time, and that could be for exams. Maybe it's because of processing speed, a learning disability, or it could be because of brain fog due to a student's medication or anxiety. So there's a lot of reasons that someone might need extra time on tests. The other type of accommodations that I have listed here are a laptop in class or the ability to record a lecture. You might think it's 2021, who doesn't allow a laptop in their classroom? And you would be surprised because some professors actually do not allow laptops in the classroom unless the student has an accommodation. Students might need a laptop to be able to take their notes by typing, or if they need it because of their processing, or if they need to, be able to focus on the board and they want to be able to listen to that lecture later because of a cognitive processing speed issue, or because of some medication that they're taking, or, there's a lot of different reasons why someone might need that. So permission to use the computer and permission to have class notes is an accommodation that students can request. And there's a lot of different ways that universities address the note taker piece. Some universities have other students who take notes for the classes, others record the lectures and then provide a transcript of those classes. And some universities actually hire professional note takers to take notes in those classes. Some students might need a distraction-reduced testing environment, and that looks different at different universities. So that could be just fewer students in the testing room. It could be a single room where the student is taking an exam, and that could be because of anxiety or distraction. There's a lot of reasons that students might need to have that distraction-reduced environment. Looking at some of the housing accommodations, the kind of residential pieces, sometimes students with mental health conditions might request a single room. or to have fewer roommates, which is another type of common request. A lot of times there's up to 5 or 6 people in a room, and that can be really stress and anxiety producing for students. And so they might request to have a single room or to have fewer roommates. Other students might request to have an emotional support animal with them on campus. It's important to remember that emotional support animals are different from service animals. So emotional support animals are allowed in the residence halls, but they're not allowed to be taken with the student to the classroom. And emotional support animals could be anything, could be a cat, could be a Komodo dragon. And so students would have to follow the process at that college or university to request that as an accommodation. I also just wanted to touch on the types of accommodations that students with health conditions and physical disabilities might be considering. So sometimes students might need priority registration if they need to be able to take classes at a certain time because they need support in daily living. So getting dressed or supported with medication, or they have medical routines that need to take place at a certain time. They might request priority registration so that they can choose classes at times that work for them. It could be classroom relocation. So the area or space on campus where their class is located, if their classes are too far apart, the university might be able to provide the accommodation to bring their classes closer together or to put them in a specific space or on a specific floor. That might become important for somebody who uses a wheelchair or who has limited mobility. A lot of students who have certain health conditions that cause fatigue might have trouble actually navigating and getting around campus. So they might need to have their classes located in a more centralized area. In terms of housing accommodations, we might be talking about things like a private bathroom or a single room or an ADA accessible room. We might also be talking about having a personal care attendant if someone has more care needs and they need someone to support them with toileting and showering and getting dressed. Colleges do not provide one-on-one aids for students with physical disabilities. Lots of high schools do, typically public high schools do. And so that's a big adjustment for families to understand that they would have to hire a personal care attendant to support their student on campus. There are 2 colleges that have personal care attendant services built into their program, and one is the University of Illinois at Champaign, and the other one is Wright State in Ohio. So if your student needs personal care attendant services, they might want to start by looking at those schools and then branch out from there. The other pieces to think about too are campus accessibility. So is there transportation on and around campus? Can the student get around independently? Looking at some of the programmatic accommodations. So oftentimes we don't talk about, students with different disabilities, whether it's a hearing impairment, a visual impairment, a physical disability, an anxiety disorder. How are they accessing programming on campus? Like when a speaker comes or there's a concert. So they want to be asking those questions about how they request accommodations to be, or in order to engage in student life and student activities. So there might be programmatic accommodations like preferential seating or interpreters or CART, which is real-time transcription, which might help a student kind of be able to engage more in student life. And Adrienne, I'll hand it over to you.
Thanks, Annie. So outside of the traditional sort of full-time college path, I also work with students who would like to take some time off before being fully enrolled as a matriculated student. So non-matriculated student status is one way that a student can start college, but not be fully committed as a full-time matriculated student. So with this non-matriculated student status, a student can simply take one course at a college or university without any commitment aside from that single semester. So that student will receive college credit for the course. And some colleges do have a limit for the most part with how many classes they can take with that non-matriculated student status, but it's definitely something to consider and a great way to experience success in the college level and just really focus on one class. So that's definitely something I would recommend. Part-time student status is another way students can lessen the load of academic work and kind of ease into the transition to college. So for most students, a full-time course load would look like 4 or 5 classes. Part-time students would take something along the lines of, 2 courses. And the only issue that has come up for me with part-time student status is that colleges do have a minimum number of credits needed in order to activate financial aid and also activate living on campus in campus housing. So this varies from college to college and is definitely something you could find out by calling financial aid or calling Residence Life. Gap year programs are another great way for students to grow in their independence, learn something new, travel, and really increase their maturity. So, for some students who know for sure that the gap year is the path they'd like to take, they, during senior year would say, I'm not going to apply to college and I'm going to wait. The other path is to go ahead and apply to college and request a deferral. And, there's certainly been a growing trend over the past few years of students really interested in this, particularly in COVID. Many students did request deferrals to take that extra year off. And it really allows them that time to figure out maybe what they'd like to do, to really get a job, or to figure out, to intern. Sometimes students defer for health reasons or to really just take a break between high school and college. And students can apply for a deferral after they submit their deposit in May, if they would be doing that during senior year. An associate's degree or a tech school also makes sense for some students if academic work is not something that they're interested in, or four-year college feels like too much. I encourage students to hone in on their passions, and I help guide them towards a tech school or a path such as, going to school for, it could be massage therapy or beauty, things like that. An associate's degree is typically 2 years and can also lead students to transferring to a four-year college if they'd like to do that down the line. There are also many accredited programs out there. So I'll pass it back to Annie because I know we're getting close to the timing.
Great. And I will briefly talk about some policies that I just wanted to make sure that folks were aware of. I wanted to touch on leave of absence policies and withdrawal policies. This is a topic of conversation. Adrienne and I both mentioned that we are academic advisors at the dorm, as well as having our own practices. And so sometimes leave and withdrawal policies come up in our work. And so every school has their own policies. So students and families might want to explore those policies before they select the college, just so they can get a sense of what is the medical leave policy. If you know your student has a chronic health condition that has unpredictable flares where they have to maybe miss weeks of school, you might want to just familiarize yourself with that medical leave policy, and also look at the personal leave policy as well. You can typically find those things in the student handbook. Those are the buzzwords: medical leave and personal leave. So if you open up a university student handbook and type in those words, you should be able to find them. And you want to look at the reentry policies. Typically, when someone takes a medical leave, there is a policy or a procedure to reenter school. You want to make sure that you're familiar with that as well. There have been some high-level settlements in court cases recently, one specifically around Brown University and their reentry policies. And so you want to make sure that you know what that reentry policy is and what it looks like for that specific school. Withdrawal policies, just briefly. Sometimes withdrawals can be retroactive, depends on the school, depends on the student, depends on the situation. But you should look at what the school's withdrawal policy is. There usually is a deadline if the student wants to withdraw from a specific class. There's a deadline to do that by. There's also a deadline to withdraw from the university, and some of those have financial penalties attached to them. So if you're interested in knowing that ahead of time, and you can kind of chart those dates out, that might be helpful for students and families as they're making their plans and looking at those considerations. So I wanted to make sure that we touched on that today. And finally, you can connect with us. Adrienne, we've put up our connections here. So we've got our websites. I'm Annie from Accessible College, and then Adrienne's down here at Lighthouse Guidance, and we're on all the social media channels, so you can find us there. And here's our dorm contact information as well, so you can connect with us. And then we will take your questions now. So Sam or Elizabeth, should I stop the share now and we can jump in to see if there's any questions?
Yeah, you can jump right into gallery.
Okay, I will stop my screen share and we'll put up the gallery. And then if you have a question, I guess you can either unmute yourself or indicate otherwise, either by physically raising your hand, or if you are Zoom savvy, you can go down to reactions on the bottom right and click the raise hand button, which will indicate to us that you have a question. Or you can put your question in the chat box. We are happy to field any questions you have.
Check the chat box.
I am going back through. It looks like Kathy had a question about colleges that have programs focused on LD and autism, which is true. There are a lot of colleges that have specific programs. She asked if there were any programs that were focused broadly on chronic health issues. And Adrienne had provided an answer too about some programs and organizations on campus, but in general, there aren't really any schools that focus on the needs of students with chronic health conditions, although some of those support programs do provide supports to students with other types of conditions. So you would want to look at the specific schools and what those support programs look like. I would also say that there's another organization called the Health Advocacy Summit, which is a group of students with chronic health conditions that are prolific on Twitter. And they have put together a lot of information on their website too, specific to students with chronic health conditions in college. So that might be a valuable resource too. There's another network called DREAM, which is part of the National Association of College Students with Disabilities. And the DREAM network is another great kind of network of students with disabilities of all types who talk about their experiences on specific college campuses. So that could be another resource for you as well. Adrienne, are there more questions that you're seeing popping up?
I am, we're looking, there's another question here about, is there anything you guys can speak on as far as accommodations for students that are doing undergraduate volunteer work, like pre-meds, health students working at a hospital or a lab?
Yeah. Okay. Since I've been on the other side of the desk in the college setting, it kind of depends on what the students' needs are in terms of the types of supports that they need to be able to engage in the community. Most of those programs, nursing programs, medical programs, have technical standards. You'd want to familiarize yourself with what those technical standards are, because the students have to be able to meet those technical standards. So if the technical standard is that the student has to be able to demonstrate XYZ, technique, and they have to be able to do that consistently, then, if they have trouble with that, then they might not be able to complete that program. Alternatively, if the student has a mental health condition or a chronic health condition and that they have flare-ups and they're not able to get to their lab or the hospital site, which is kind of a thing that comes up a lot, then they need to engage in that interactive process to request accommodations. And that's going to require them to sit down with the Disability Support Office and their program managers to have conversations about whether or not they're allowed to make up that time, what the typical practice is for making up those labs or that in-person experience, because there might be some limitations around that. But it's critical for students to engage in that process and to document that process throughout too, so that they can have that conversation up front, as opposed to waiting until things are unfolding and then the toothpaste is a little bit out of the tube, as they say.
That's definitely the greatest challenge. With some of the students I work with after the college process, I'll keep in touch with them. And I think waiting until the last minute to ask for the accommodations is generally a chronic issue that we see, where students will then wait until the grades are so bad and they've missed too many labs, or they're just not asking for help until it's too late. So that kind of connects with that last question about encouraging students to be their own self-advocates. And that's something that, during high school, it's really important to really work on those skills and to allow the child to be asking for the accommodations and to be the driver in that process and practice those skills before going to college. I mean, it's even something as easy as like waking themselves up in the morning, and that's a challenge for some of the students, just being able to like make their own food. One of my clients has never done a load of laundry. I mean, these basic skills, certainly are going to come up in the college piece as well. So definitely working on those skills, putting the child in the driver's seat for their accommodations and just for general life skills is a recommendation that I have for self-advocacy.
Yeah, and just to build off that, Adrienne, the accommodations process in college is not retroactive. So if a student waits to request accommodations until halfway through the semester or later, it's too late at that point. You can't go back. So I always tell students that accommodations are like insurance. You want to have them in place before you get into the car accident. And then you can utilize them if there's something that comes up. Students typically don't always realize too that they don't have to use their accommodations. So even if they have the accommodations, they don't have to take the test in the testing center with extra time. They could take the test with everybody else in the classroom under standard time, things like that. So all of this is just that engagement and that conversation with the student and the Disability Support Office, which is why it's critical for students to have that link with the Disability Support Office and make sure that that office is a good fit for them and they feel supported by the people in that office. So that's why I think it's important for this to be a part of the college search process conversation as well. And I see some other questions too that came in.
Yeah, I saw, have you seen access programs in action on campus? This come in from E. Kinsley.
Okay. And I guess to the person who wrote that, is an access program is that a specific type of program? I might just not be familiar with that terminology. So if you want to follow up.
That's what I was wondering. I was looking at something by a guy out of Syracuse. He's doing a lot of talk about that, and I don't know if he was using that as just a general term, but it seemed like it was something much more specific, and I hadn't really heard much about it, and I was trying to figure out what that might be.
I will look into that for you. I have, as I mentioned, had students apply to the On Track program, which is a support program academically speaking for students, but I can look into the access program certainly for you.
And Syracuse, just because you brought up Syracuse, is one of, I think, 5 or 6 schools that has a disability cultural center on campus, which is separate from the Disability Support Office. So Syracuse has a more intentional focus on disability rights and history, and provides opportunities for students with disabilities more broadly to connect and engage in that disability cultural center setting, not just in the Disability Support Office, which is something different than a lot of universities have.
Maybe that's part of what it was. Thank you, because that's really cool.
Yeah.
Whichever schools are in there.
I think University of Arizona, University of Illinois, Chicago, those are the ones that come to mind.
Yeah, okay,
But
thank you.
Fun fact, I recently wrote an article about this, so I'll make sure that that you can get linked to that.
That'd be awesome.
Yeah.
Thanks.
Sure.
I see a question from Kathy. I think we kind of answered this, but do you have any tips on how to work on self-advocacy skills for students who really struggle in making progress on this skill?
Yeah, I think, we kind of touched on that in terms of practicing those skills, and, in terms of the disability piece, as Annie talked about, it is really the student who is accessing those services at the college level. So if they want to get their accommodations, most of the time they'll have to make an appointment and actually sit down with someone at the disabilities office. Annie, obviously you've been in that position at Georgetown, but I think some of my students get a little bit nervous about having that meeting and sort of what accommodations to ask for. So I'll sit down with them and kind of go through which are the accommodations that you're hoping to get at the college level, and thinking about what did you use in high school and what do you really feel like you need to use in college, and having that prepared and written down. So that can kind of ease some of the anxiety beforehand, so they know what they're asking for.
Yeah, building off what Adrienne said, I will often rehearse that conversation with students so that they can say what the accommodation is that they are requesting and why they need it based on whatever their condition is. The other piece of that too, just on building those self-advocacy skills, is finding little inroads in your daily life, right? So Adrienne mentioned some of like the daily living skills, like can the student make a meal? Can the student do laundry? Some of those, more common skills, but also like, does the student know how to make a doctor's appointment, right? Can you start to hand off some of these pieces to that young adult while they're still at home under, guardian or parent supervision? Which sometimes is quite complicated as a parent. I think anybody who is a parent sometimes feels like it's so much easier for me to just do this for my kid than it is for me to wait to see if they have done it. But there's a really important learning piece there that's really essential for students, because once they go to that college setting, they need to be able to, pick up that phone and have a phone conversation and not just be able to Snapchat. They need to be able to write an email that makes sense and then conveys some of those pieces that they want to convey. So you can start to work on those skills, as early as middle school through high school, so that the students are really more comfortable and confident having those conversations. And that could be as simple as, telling your child, okay, we're going to school, you're going to the doctor tomorrow. Why don't you write up 3 questions that you have for the doctor and prepare those, and so that you can ask the doctor those questions tomorrow. It could be like those little inroads, finding those little inroads and letting the student actually speak for themselves. That's what's really important.
And then to answer the question, the good resource for gap years that include mental health support, the Gap Year Association, I would definitely recommend that. And then they list their level of support there between 1 and a 5. So you can definitely check out that website there. I've had a lot of students seek out gap year programs that have that extra support to really work through some of those issues, as I said, kind of before going to college. So I have some personal examples of programs. If that person would like to, Holly would like to reach out individually, I'd be happy to share some of the personal examples of gap year programs that have had that support.
Someone else, yeah, go ahead, Sam.
No, I think we have to wrap up soon, but I wanted to open up the floor to any last questions real quick. This is an important topic.
I wanted to jump in, Sam. Thank you guys so much for this presentation. This has been fantastic. I feel like we're beginning to see how technology, especially during COVID, has really, especially as it relates to mental health treatment, really revolutionized what's possible, making care accessible in ways that it really hasn't been before. How do you see technology impacting accommodations? And do you see sort of the same type of creative thinking in that space?
John, you're asking the $1 million question. So it's a little bit tricky, right? So for a lot of students I work with who have chronic health conditions that have flare-ups, having remote access to education has been amazing. They have loved it. They're like, I don't have to worry about getting to the place. I can just access school. We now have proof of concept because universities have done remote education now for a year and change.
Yeah.
So whether you're at, a community college or at Harvard, they've proven they can do it. So it's going to be interesting. I think what we're seeing right now is that there are a lot of people who are requesting remote access to classes as an accommodation, and it's really varied about whether or not it's being approved as an accommodation. So I think we're going to see a lot of litigation, which case law is what typically informs the types of accommodations that colleges, accept and promote. So that will be interesting to see how that kind of plays out. And then more broadly, looking at kind of universal design for learning and how students are accessing education. Some schools are just automatically providing remote access to college, remote access to classes, recording their classes, making that available to students, providing all the students with notes. So it really varies from school to school. But I think we're going to see that because they did it all last year, that there's going to be a lot of push to put more things online. Adrienne, do you have any comments to make on that?
Definitely. I also think for some of my students with mental health issues, they feel more comfortable completing their classes online. And this year, for a number of the institutions, you can choose, do you want a hybrid model, which you'll be partially in person, maybe like a handful, 5 sessions, and the rest will be online. They feel much more comfortable with that choice as opposed to in person for all of the class sections. So teasing through all of the course guides and kind of finding out like which classes are hybrid, which are fully online, which are in person. And that definitely played a part in the decision for which classes my clients wanted to sign up for. I also think students were more likely to feel comfortable requesting accommodations because they could have it over a Zoom call. They didn't have to necessarily go in person for their meeting. So I think that those were some of the trends that I saw kind of going into this fall. So I'll be curious to see sort of what happens when the schedules come out for spring 2022, like how many classes will be offered online and hybrid, or will it be kind of going back to more in person? So it'll be really interesting to see what happens over the next few months.
Well, I think you're both rock stars. I really appreciated that presentation and congrats, and thank you all for attending. Wanted to shout out our next roundtable will be on September 30th with Recovery Roadmap Specialist, where we'll be discussing 3 keys to help families go from panic to pain, a roadmap for eating disorder treatment and recovery. And we're following up with a link to join that discussion. But again, thank you all so much for joining. Thank you, Adrienne and Annie. It was great.
Thanks, everyone.
Thank you.
Thank you.